Protecting yourself from skin cancer. Risk for skin cancers like melanoma are high in firefighters because of exposure to carcinogenic chemicals and ultraviolet or UV light. Melanoma is the most serious type of skin cancer. The most common areas where our skin is exposed to the sun, like on the back, legs, arms, and face. But it can also occur in other areas like the soles of the feet, palms of the hands, and fingernail beds. The good news is that skin cancer is highly preventable if you detect it early and take proactive measures. To detect skin cancer early, regularly check your skin for changes. The first sign of melanoma is often a change in an existing mole or a new and unusual-looking growth on the skin. You can use your ABCs to identify unusual moles that may indicate skin cancer. A, B, C, D, E, that is. A is for asymmetrical shape. Look for moles with irregular shapes, such as two very different-looking halves. B is for irregular border. Look for moles with irregular, notched, or scalloped borders characteristic of melanomas. C is for changes in color. Look for growths that have many colors or an uneven distribution of color. D is for diameter. Look for new growth of a mole larger than a quarter inch. E is for evolving. Look for changes over time, such as a mole that grows in size or that changes color or shape. Moles may also evolve to develop new signs and symptoms, such as new itchiness or bleeding. Potential signs of melanoma include a large brownish spot with darker speckles, a mole that changes in color, size, or feel, or that bleeds, a small lesion with an irregular border and portions that appear red, pink, white, blue, or blue-black, a painful lesion that itches or burns, dark lesions on your palms, soles, fingertips, or toes, or on mucous membranes. Because melanoma can also occur on normal-appearing skin, make sure you see a dermatologist regularly for routine checkups. There are many proactive measures you can take to reduce your risk of skin cancer. Keep your gear clean to prevent harmful fireground carcinogenic contaminants from entering your body through your skin. Properly wear gear like your protective hood and helmet ear flaps to minimize contaminants from settling on the skin in those areas. Following any exposure to contaminants, quickly use cleansing wipes to remove as much as you can. Showering as soon as you can to limit the amount of time that contaminants are in contact with the skin. Cumulative sun exposure may also cause skin cancer, so no matter how cloudy it is or what time of year it is, wear broad-spectrum SPF 30 sunscreen and reapply it frequently. Also, prevent unnecessary exposures to the sun as much as you can. Wear protective clothing that covers your head, arms, and legs. And when performing non-emergency activities like apparatus maintenance and training, position yourself in shady areas when you can, especially between 10 a.m. and 4 p.m. when the sun's rays are strongest. There are many simple actions you can take to minimize your chance of skin cancer. Your future self and loved ones will thank you for taking these actions to preserve your health.